Welcome to the program, The Dialogue, where we focus on various issues that affect our society. Today we are focusing specifically on the COVID-19 pandemic, which has devastated societies in virtually all parts of the world. It has claimed unspeakable casualties. It has placed families as prisoners in their own homes. And to look at this issue today, we've brought into the studio Professor Royen Mavenyengwa, who is the chairperson of the Department of Microbiology at the University of Zimbabwe's College of Health Sciences. Professor Mavenyengwa, welcome to the program.
Thank you very much, Peter.
We have also in the studio Dr. Maxwell Rupfutse, who is the National Professional Officer with the World Health Organization. Doctor, welcome to the program.
Thank you, sir.
And last but not least, we have Dr. Ivan Maroa, who is a lecturer in the History Department at the University of Zimbabwe. Welcome to the program, Dr. Maroa.
Thank you, sir.
Now, to start off, Dr. Maroa, in terms of history, is this the first time that we are having such a devastating pandemic?
Thank you for that question. History tells us that the world has experienced such pandemics for over 200 years going back into history. But if we look at the past 100 years, in 2018, the world was actually celebrating the 1918 Spanish influenza, which affected the whole world and had actually devastating effects, claiming lots of lives throughout the world, Africa as a continent included. So this is not the first time. From 1918, before 1918, we had the bubonic plague in 1900. Before it, there was the Russian influenza, 1889 to 1890. So after the 1918 Spanish influenza became the most devastating pandemic the world had ever seen. In
terms of casualties, what are we looking at?
In terms of casualties, we are looking at researchers estimate the death, the mortality rate to be at 50 million worldwide. So the world has such an experience, from history. This is the most singular pandemic that has affected the world before this COVID-19. But from the 1918 Spanish influenza, we had the 1957 Asian influenza again. Then we had the 1968 Hong Kong influenza. And then we came to the 2009 swine flu. And then now, this COVID-19.
But we want to understand which particular influenza or pandemic really affected Africa and Zimbabwe in particular, from those that you have cited.
It is the 1918-1919 Spanish influenza.
Why specifically?
This is a pandemic which touched on almost every country in the world. So it was a pandemic which, just like COVID-19, traveled through the human body. It traveled through transportation. The world in 1918 had just come out of, industrialization. Mass societies had started to develop. Cities were largely were having large populations. So it was the first of its kind to affect a mass society. And as a result, it affected the daily activities of people. It affected the economies of the people. And it happened soon after the end of the First World War. So as ships were traveling from America to Europe to Asia to West Africa, and then to South Africa. The disease was traveling through the sea. This is the only difference with COVID. COVID is coming in various ways. Particularly, it's traveling faster because of air transport. But in this time, it was the sea communication that was the major source of transportation of Spanish influenza. So you will see that it came in 3 phases. There was the spring, the 1918 spring wave, and then the 1918 autumn wave, which became the disastrous wave, and then the 1918-1919 winter wave. So Africa was mostly affected by the wave, the second wave, which came in the autumn, right? So that's when it reached West Africa in September, October 1918. It reached South Africa, September, October 1918, and finally Southern Rhodesia, then, which is now Zimbabwe, in October 1918.
Dr. Rupfutse, should we really be making a big comparison between the Spanish influenza and COVID-19? Is there any basis for making the comparison?
Yes, thank you, Mr. Banga. There are lots of similarities in terms of how it moves across continents, in terms of how it has devastated, or the COVID-19, the devastation it has caused to human beings and its global infections. These are respiratory infections, flu-like illnesses that are easily transmitted from one person to another. They start with fewer number of cases, but within a short period of time, they increase to large numbers of cases with high mortality. The lessons learned really are to do with prevention. The best tool we have for controlling COVID-19 currently is to prevent. And how do you prevent? We want to test and test. Trace those that are infected. Isolate those that are infected. And treat the infected people. From the control measures that were instituted around in the 1918-1919 Spanish flu, the control measures are also similar. The lockdowns, social distancing, avoiding social gatherings, closure of schools, closure of churches, closure of shops, just to minimize the distance between people, because the two infections are respiratory infections.
We'll be back shortly. We are focusing on the coronavirus, the COVID-19 pandemic, which has affected virtually all societies. We'll be back shortly. Welcome back to the program, The Dialogue, where today we are focusing on the deadly coronavirus. Professor Mavenyangwa, from what we have just been told about how the Spanish influenza was dealt with, can we safely say with some degree of confidence that at some point we'll be able to subdue COVID-19?
Indeed, the Spanish flu of 1918 to 1920 had a very big toll of what has been mentioned, 50 million deaths. It infected 500 million people. During that time, there were 1.8 billion people, which means about a third of the people were affected. In fact, casualties from World War I was just 16 million compared to the 50 million that resulted from the Spanish flu. So, indeed, there are lessons to be learned from what happened during that time, in the sense that it was a new virus, it was a novel virus, just like the COVID-19 is a novel virus. Unfortunately, at that time, there was little development in terms of health systems, in terms of management in terms of drugs, and also there was very little technological development that could have been used at that time to try and combat COVID-19. But now, in 2020, all those technologies are available. Information can be transmitted and people can quickly understand the preventive methods that have been mentioned, which principally are basically the same. Is to do with dealing with a respiratory tract infection, and how you deal with a respiratory tract infection is to practice hygiene and social distancing, quarantine, isolation. So what we learned from what happened with the Spanish flu is actually applicable right now with the COVID-19.
So my understanding from what you are saying is that we are not starting from a clean slate.
That's correct.
We have lessons that we have learned along the way. But still, there is this air of uncertainty. There is so much fear.
So it's just a wave that will come for the Spanish flu. After about 3 years, then the Spanish flu went away. So we are hoping that probably the same thing is going to happen with the COVID-19, but taking into consideration other factors that determine pandemic dynamics in terms of whether people are going to practice all these infection prevention and control measures, and also whether people are accessing health services, which means the pandemic in that instance probably is going to take a shorter time. And obviously, if people don't practice those infection prevention and control measures, the pandemic is going to take longer.
But we have those control measures in place, the prevention measures in place, but still we continue to get new infections. Doesn't that worry you? Because really we should be at a stage where we should be seeing infection levels going down.
That's correct, Peter. To be honest with you, one is to be worried that cases are actually increasing in different countries. Of course, other countries have reached a point which we call flattening the curve. In other words, the number of new cases are becoming less. But now, when you are dealing with a pandemic, you are dealing with an infectious agent. You are dealing with a biological agent. And when it comes into a population, there are a number of factors that are going to take place. For example, conceptualizing these methods of prevention. There are going to be people who take late to get into the ship to implement the necessary measures. And then there are people who get tired and jump out of the ship too early in saying, we've been staying at home, what does it really mean? And then they slacken in terms of practicing these hygienic practices that are important in reducing the instance of COVID. So what it means is that we have to have sustained efforts from all fronts, from research, from economic, social support from government or from partners, so that the momentum continues to be there, so that we can actually deal with this pandemic.
What we are also looking at is a certain laxity. We are under lockdown. But should we really at this point be really celebrating that Zimbabwe has relatively very low statistics?
We really need to be on our guard throughout. The risk that is there is that the numbers or number of people that are going to be infected may actually start to increase in the next few weeks or so. Learning from other countries, they started, like we said before, with very few cases, and the numbers rapidly increase. So if we relax our control measures now, we risk having high number of cases in the next few days or next few weeks. We really encourage every Zimbabwean to take the necessary steps necessary to prevent this disease, to heed the recommendations that have been given by Ministry of Health officials, by the government of Zimbabwe, to really follow the government instructions in terms of the preventive measures that are being put in place to reduce the transmission of this disease.
Dr. Marwa, can you comment from what he has just said about the efficacy of each measure?
Thank you, Peter. You know, in a setting like the Zimbabwean setting, where there are certain traditional customs that we have within ourselves, there is always a danger of, or what we can call a crisis of comprehension, where people lack understanding of why these measures need to be followed religiously. Take for instance, people are not encouraged, to shake hands. But when you move around in these different suburbs, you always see one or two individuals, shaking hands, hugging. So what is really needed from the society is that willingness to comply with instructions, willingness, to follow what is being said. Social distance will help because, as we are saying, COVID-19, just like the Spanish influenza, is a crowd disease. It spreads through the human body. It spreads, from sneezing, from coughing. So as people gather, the disease will spread. As people shake hands, the disease will spread. So this is the danger. So the greatest thing that we should do as government, as organizations, as people who are involved in spreading awareness to the society, is to make sure that we make these people develop a willingness to follow the instructions. Otherwise, hand sanitizers, washing of hands was proved to be effective in 2009 when swine flu broke out. For the first time, this is how it was managed to be contained within, a limited space of time. But if we don't do that, it's going to be disastrous, for our society. So we need the people to understand, to follow these instructions. Yes, people are not going to, pupils are not going to school, universities have closed, church gatherings have been stopped. But people are gathering to buy tomatoes, to buy vegetables. And no one is making a follow-up, to make sure that these measures are being followed.
Who should be making those follow-ups?
If you look into history, you will see that, for instance, I'll give you an example of Nigeria. In Nigeria, during the Spanish influenza, they had to come up with volunteer campaign teams. People volunteered to do what they called house-to-house visits. But today, we don't have such.
We are focusing on the coronavirus, the COVID-19 pandemic, which has affected virtually all societies. We'll be back shortly. Welcome back to the program, The Dialogue, where today we are focusing on the deadly coronavirus. What has been demonstrated is how community homegrown solutions can actually come about. Can you maybe comment on that?
Yes, communities need to be part of the fighting team, especially when you are faced with a pandemic like COVID-19. But we should also be very careful because, in this era we are in, people are susceptible to anything that comes along. So I think a few weeks or days ago, I read something on social media that someone is claiming that they've found a traditional herb that cures COVID-19. It has not been tested. And people can rush. There are some, some prophets who are also claiming that they want to go and have the disease destroyed. So these things will make the community believe anything that comes along. So that's where, in the last segment, we were saying information is very vital. So for communities, they need to be involved in what is happening so that they understand what is happening and what they need to do towards finding a vaccine. But the vaccine will not come immediately. What we are banking on at the moment is making sure that we practice good hygiene, we use the face mask where possible, we continue doing social gatherings, social distancing, avoid all these other gatherings that are not necessary. So when we do this, we'll be playing our part. We want to give time as researchers are doing their work to get us a vaccine. It might not come anytime soon, but whenever it will come, we need to be doing our part as a community.
Post-COVID-19 scenario, in light of the synergies that have been built up, what sort of a situation do you see evolving, or what sort of situation do you prefer to see?
I envisage a situation whereby, especially for us as scientists, we don't take a break like we've done with the other previous pandemics which came and went and then we forgot about them. We need to continue providing local solutions, sustainable solutions in terms of translational research that will come from what we do, that applies to our situation, so that when we face next pandemic, we'll be better prepared to deal with this pandemic. I think post-COVID, we need to really keep the important lessons that we would have learned so that we prevent a future catastrophe.
Really, as WHO, we implore and ask societies, researchers, scientists, institutions like University of Zimbabwe to work more closely together, even together with the government of Zimbabwe, doing more research to find more local sustainable solutions to this pandemic we are having. We also really would like, as said earlier on, to encourage our citizens of Zimbabwe and citizens around the world to take heed and comply with the messages and informations that are being provided by health officials and by our national governments.
Thank you, Peter. This COVID-19 has come. It is going to give us lessons on behavioral change. So if we follow what we are being taught, it means post-COVID-19 we will see a lot of behavioral change from the people of this country and from the people around the world. That's number one. Number two, we also need to be aware that we are going to have lots of orphans and lots of other things to deal with, especially death, because right now we are only talking on numbers, but we are not specifying in terms of age, in terms of gender. But at the end of it, death will always affect communities, families. So governments, I think, should be prepared that after COVID has been suppressed, we need to deal with the effects of death, because death will always be there in the families until we also pass on. So it's a great challenge that needs to be prepared, because people will live with it until for so many years until they pass on. Thank you.
There you are. We were focusing on the coronavirus on the program, The Dialogue, with Professor Royen Mavenyengwa from the University of Zimbabwe's College of Health Sciences, Dr. Ivan Maroa from the University of Zimbabwe's History Department, and Dr. Maxwell Rupfutse from the World Health Organization. We sincerely hope that you learned a lot from what is being done to combat COVID-19, and also what we can look forward to as we look at the post-corona scenario. Until next time, it's goodbye for now.